these will be helpful when we get this data all together to come up with a guideline that will tell us how often do you need to get imaging. For example, in 2015 came out a paper for the patients with multiple sclerosis, and they have a 1 to 2% chance of having chondrosarcoma, but the paper says that after 16 years old, they should be doing a whole body MRI every 2 years because of 1 to 2% of chance of chondrosarcoma. So what should we do with the patients with other disease? We should be thinking of that also. I think in an older age, because as we see here, it's not as young when the patients will have, in the median average age, will have a malignancy or cancer, but I think we should be thinking of that also. So this is, the paper it's submitted and we are doing the final analysis of these numbers with the other authors to come up with a guideline that is more concrete based on these numbers. So we are all analyzing that with the statisticians now to come up with what is really statistical significant and that we can use to define guidelines. So for the patients with Maffucci syndrome, the numbers are very similar. I really cannot put any weight on the survey because the numbers are too small. The numbers from the literature are more or less the same as in the numbers for the patients with Olia disease. The patients with Maffucci actually have a median age for the appearing of the cancer that's a little older. They are older than the Olia. The patients with Olia disease, they're around 30. But again, chondrosarcoma is the main. But then it comes the good news. Brain cancer is like 4 times lower the risk of having brain cancer in patients with Maffucci syndrome. So if you have Maffucci syndrome, it's much less likely that you have any kind of brain cancer. And then the gonads is also less affected. The patients with, but they do have a higher risk for having malignancy, vascular malignancy, because they have vascular anomalies. So all this data is going to be used to us to come up with guidelines and aids of what tests you should be doing. This is what we want. And then give this information to the physicians, and wherever you go, they know what to do and when to do. So this is what we are trying to reach with putting all this data together. Then, I don't know when I'm on time. Okay, yeah, because here it's just I think these are the 2 final designs, and it's mostly just saying the difference between patients with Olia disease and Maffucci syndrome. I sent that slide to you, Charlotte, so if anybody wants to get that, you can maybe give it to them, but it's like, the main difference here is the tumor, the brain tumor prevalence, it's much lower in patients with Maffucci, and patients with Maffucci have cancer in an older age when they have it. They also have the vascular anomalies that patients with Olia don't, because they don't have vascular anomalies, they don't have vascular malignancy. So these are the main differences we have here. And then this is what I summarize now as what the patients with Olia disease mostly look like. So they have an earlier diagnosis in general. We know that the enchondromas are affecting mostly, this is order, what was found, first the femur, then the small bones of the hands, and the tibia. So these are the 3 main places where the enchondromas appear. They also can affect the skull, the ribs, and the spine. They are mostly one side, but you saw them mostly. It's mostly like 51, 52%. It's almost half and half. 53 of them had a malignancy. This is coming from the survey. Oh, from the literature, the survey was 55. Mostly chondrosarcoma. The brain cancer is something that we need to surveillance. And they were younger when they had the malignancies found in comparison to the patients with Maffucci. Then the Maffucci, it's almost the same. The only difference is they have vascular malignancy, as I said. They are older when they have malignancy. But as I said before, both sides are affected in 50%, and one side in 50%. vascular anomalies. Also, we're more likely in one side, but it's again a little bit higher than 50. It's almost the same. So just to end, I just want to tell you that there is no really special reason why I got so involved with studying early disease and Maffucci syndrome. Some patients have asked if I had someone in my family. It was not it. I just started doing my PhD and I started getting interested, and as I met the patients, I just got like more committed to it, and nowadays it's actually what the main reason of my lab. So here are some of the grants that we have. I have one that is a grant from Hopkins that was giving me to study some variants that I found doing RNA-seq and proteomic analysis. So this is, I did the sequencing, I found the genes that I think are causing the disease in this patient, and now I want to study the effect of this gene on everywhere else. So to do that, I'm doing RNA-seq and proteomic analysis. That is too much to understand, but it's like it's a step further. I would take forever to explain that now. But the other one, and this one here, and this one, I think some of you are actually part of it. This one is to do, I just got that last year. This was a very important one from NIH. NIH is giving me whole genome sequencing on 100 trios. So it's 100 patients with Ollier or Maffucci. They can do whole genome sequencing, and they are also giving me whole genome sequencing and RNA-seq on the 50 tumors of 50 of these patients. So this is really, really very important. And I think we have done, as of now, we have done 30 and we have 20 more to send. So this is really important to us to understand the complete picture of the patient. So if you are of the what's causing it, and it's all to get down to treatment. So if you are interested, please send me an email, contact me on Facebook, and I'll tell you more about that. This one I'm not the main PI, but I'm a co-investigator, and it's to do whole exome sequencing. So I can also do whole exome sequencing for patients with early disease and Maffucci syndrome. These are both NIH-funded projects. And this is important because getting NIH or any other foundation to fund diseases that are rare, it's really hard. So having this, I'm very thankful to everybody who has participated and given me samples, because being able to tell them, it's rare, but I have samples from 100 patients, really, it's a game changer to them to decide to invest on research. If you say like, it's rare and I don't have anybody, they're like, what the heck am I going to give money you for? What can you do? So this was really important when we got that. I'm very happy with that. So with that, thank you very much. Thank you, thank you.
Well, that takes us to the end of today. I know that lots of people have approached me wanting contact details for different people, and I've had lots of you talk to me, so my brain is just thinking, oh, who is it that wanted what? If you can just please email me, you all have my contact details, who you want to ask questions to, who you want contact details for, what you want more information about, and I will respond to everybody that way. It's easier to do that than me try and remember who said what, and I know at the end everyone's going to pounce on me again. So if you can email me, that would be brilliant, because I will, I do respond anyway. Also on your table are evaluation sheets. Please can you just fill those in for us, that would be great. Also if there's anything to do with the children's events, if you're interested in that, if you can pop some details on there. Red Robin Trust, things are here, you can see them displayed around the room. We've got bags, t-shirts, Christmas cards. They're over there where Oliver is. Can you wave, Ollie, so they know you're there? And for the future, I'll get the 2019 date out to you for next year's conference. And I think it's really important, because what it's really come up today with professionals is how much they have enjoyed it. So every one of them has taken me out there and just absolutely praised this event. So I think the important thing is you need to be speaking to your consultants and inviting them to this event. They need to be sharing what they know But more importantly, they need to learn from you, and that's the massive thing that they've been telling me out there. So the 2019 date will go out ASAP, as soon as I've booked it. Yeah, and your professionals attending. Thank you ever so much, everyone.
Can I just say, because we don't ever really thank Charlotte, because actually Charlotte has done so much to kind of get today sorted and that.